Well, it's a shameful reality that many children in South Africa are abused or neglected. The Adopt a School Foundation says there are significant challenges in safeguarding children, and the abuse, neglect and violence that might be suffered is experienced at school, at home and in the community obviously affects learning.
To discuss what can be done about this concerning problem, we are joined by Melanie Spencer from the Adopt a School Foundation. Melanie, a very good morning to you. Thank you so much for joining us. I mean, children are facing all kinds of issues. I mean, just in this weekend alone, we've been talking about a 17-year-old who was raped and killed and who was, buried rather laid to rest yesterday. I mean, they have to be focusing a lot more on their schooling and just growing up. And yet now we're talking to them about making sure that they look over their shoulder, that they protect themselves, because we, as their grown-ups, as their elders, are struggling to do that. I mean, what does a child have to now do to ensure that they can actually live a full life?
Hi, good morning. It's wonderful to be here with you. Yes, it is very, very concerning what is happening with our children in the country. We see the stories every day, and it's very disturbing. What does a child have to, your question is, what does a child have to do to be safe? It's really not within their power. So I think to answer your question, it's the duty of the adults and the system and the schooling system and the homes and the communities they come from. The onus is on the adults to protect the children and to keep them safe.
Yeah. The problem here is that, unfortunately, the adults are not doing a good enough job in some instances of keeping these kids safe. Otherwise we would not have so many children that die of abuse, so many kids that are killed in school, so many children that are facing just life-threatening kind of dispositions in life. Have we as adults relegated our responsibility to parent, or relegated our responsibilities and our duty really to have a child belong to a community? Because there was a time where a child was just not my child, it was the child of the village. Have we completely relegated that responsibility?
I don't know the answer to that question. It feels like some of us may have abandoned. I know that there are many of us that are working in the schools, the teachers, some of the community organizations, the NGOs that are deeply concerned and that are getting involved and have been involved for many, many years. I think that, for a young child, it's very disturbing because they really are at the mercy of the adults. Whereas your high school learners can at least, they've got more agency. They're aware of where they can go. They're aware of what they can potentially do to try and stop the abuse, and that they have avenues of support they can go to.
There is a mother who is currently held in custody, Melanie, for poisoning her 2 children. Now, if you have a mother who bore these kids, who carried these kids for 9 months, bore these kids, we would assume had built some kind of a bond with these children, raised them for however many years they were alive, and then decided that she's going to poison these children. I mean, yes, I understand you do have that, postnatal depression. It is a reality that does happen. But when it goes as far as you deciding that you're going to take it upon yourself to end your kids' lives, now you've got a parent that is going to do that. What does an Adopt a School Foundation, for example, what can you actually do for a mother like that?
If I can just mention briefly what we do as Adopt a School. So I'm in fact with Cyril Foundation. So we are a foundation that works in education and in small business development. So on the education side, we've been active in the space for more than 20 years. Adopt a School itself turned 20 last year. So we have a program that we're currently working on, and we have worked on for 5 years. It's a pilot, and we've tested it, and it's successful, and we want to roll it out to many more communities where there's an urgent need. The origin of the program of TARI came from our work in the schools over all those years. So we could see that there was abuse. We could see that the children were struggling, and very importantly, that they weren't able to, complete their schooling. Sometimes they weren't able to their schooling was being affected, their learning was being affected. So we could see this was happening, and we could see also the rise in abuse over the years. So we then conceptualized this model called TARI. We actually got a model from UNICEF, and we adapted it, and we took some other elements from other community models. So what TARI does is it's located in the flagship pilot is in the Free State, north of Bloemfontein, and it's located in 8 schools. So these are no-fee schools. So there's a lot of cases of abuse. There's a lot of problems in the community, social ills. And in fact, that particular community, while we went there, we'd been operating, a doctor school had been operating there already. And the district officials asked us to come to that community because of extremely high levels of gangsterism. So children were literally, coming to school with guns and weapons and shooting in the school. And so it was really quite out of control. So we went to this community. The program is comprised of 4 primary schools and 4 high schools. So what we did is we took auxiliary social workers. They call them child and youth care workers. And these guys are trained by government, so they're trained in the field. And so each school has one of these child and youth care workers, and then there's another one that manages the safe park, and they report into our social workers. And so over the years, we've been able to really see some really excellent results. First of all, the community was very supportive of the program. Essentially, I think you could say there was a gap in the area. So they don't have these child and youth care workers. So that's the critical one. So there was a gap. They embraced this child and youth care worker. The schools are trying, but the issue really is that the schools are places of learning. So they're not how do I say it? They're not, their skills are not to deal with social issues. Their skills are to teach, right? So when you and the teachers we know are overburdened. They have high number of kids in the class. So this care worker is really very valuable, because what happens is on the school level, they have something called a school-based support team. So these are teachers that are assigned to look after these issues. Number one, they often don't have training. They're trying to teach all of these things. So what happens is the school-based support team members will say, okay, we've got these 10 kids. They're at risk. We can see their marks have dropped. This one is looking very sad. There's something really wrong going on there, etc. And then our care workers will take that up. So they will then they're at the school every day. They will go to the homes. They will have discussions with the parents, and they will diplomatically and in their way ask what is going on and really get to the bottom of it. The program is comprised of 3 elements, which are really very effective, the way they all work together. So there's they call it psychosocial support, which is really your social work support. Then we've got a safe park. So we've got one fully fledged physical safe park, where the cluster, the kids will go to that one in the afternoon. And that's for kids that are really at risk, that are orphans, that are vulnerable, that are, in the afternoons, there's no one to care for them, that their issues, as I said, that have been identified. So at the Safe Park, what we do is we do homework with the kids, we do reading with the kids, we play games, Scrabble, chess, soccer, and there's a physical space where they can play. And then we also then have spaces where we address the issues. So we have group sessions, individual sessions with the kids, and this is where the care workers talk to them. And then another key element of the program, which is very, very important, is about a network. We call it a multi-stakeholder forum.
Yeah.
And here we meet with all the players in the community that work in this space, because in any community there are always many of them. The point is that it's disjointed and nobody knows anybody. So here,
Melanie,
what we do, which is
we have to leave it here for this morning. But listen, we do really appreciate your time this morning. More than anything else, a big congratulations, and keep on with the hard work that you're doing and practical interventions to be able to address this issue around children being abused and taking advantage of and being neglected and the like. So really, really good work that's been done. But we have to leave it there for this morning. Melanie Spencer from Adopt a School Foundation, just giving us a couple of interventions that have been put in place. Great initiative indeed.